The Institute for Work and Health in Toronto is developing an ergonomics e-learning tool for workers who are exposed to the risks associated with computing for extended periods of time. Canadian HR Reporter TV met up with Trevor King, a knowledge transfer associate at the Institute for Work and Health, to discuss the project and the research that went into its development. What does the IWH's program set out to achieve?
So it's an e-learning specifically for office ergonomics, and it teaches people not only the risks associated with long bouts of computing or sitting at your desk for long periods of time, but also how to identify the risks and take action to prevent or reduce some of those risks.
Why is an online program effective?
This was sort of the point of the project. We've seen that many organizations are turning to e-learning platforms to train large numbers of staff in remote areas, and we wanted to know, is this an effective method for office ergonomics, as well as how effective is it? So it was really the development of this program and the evaluation of the program.
How is the program developed?
We started with the base content that had been successfully used in previous research studies for training individuals in office ergonomics practices. And then from there, we took the content and we sent it out to a panel of experts to review it to make sure that it was compliant with not only Canadian and American standards, but also the current scientific literature. And once we had all of their feedback, we worked closely with developers to transfer this in-person ergonomics training program into an e-learning program.
So how does it work?
We didn't want just the page-turning sort of PowerPoint slide presentation that people would go through. So the developers had a lot of great ideas in terms of how to keep engagement up throughout the program. So there was 9 modules that individuals went through, and within each module there were quick checks such as quizzes and questions, as well as some activities and videos with instructions.
How has the project turned out so far?
The results were very positive. I mean, it was a small study. We had about 80 participants, which might sound big, but in the grand scheme of things is actually quite small. And so we observed them before and after the training, and we saw positive outcomes on all of our measures that we were looking at. So we saw improvements in worker knowledge, reductions in postural risk, as well as an improvement in the way that people were using the adjustability in their workstations.
How effective is e-learning training versus in-person training?
Well, that's a really good question, because there is the standing question of whether or not you get the same sort of effect from an e-learning program versus an in-person training, and both have their pros and cons. So we're actually in the middle of a very large study right now. We have about 500 participants from about 7 organizations, and we're comparing both this e-learning approach, in-person approach, and then we've also added another arm looking at a high engagement approach. A high engagement involves sort of like follow-up sessions after the base training is done to ensure that individuals really understand the concepts and they have the opportunity to troubleshoot anything that they may have struggled with during the basic training.
Is this program available for others to use?
So we're in the process of getting that out there for organizations to use as quickly as we can. We just recently received another research grant to sort of tidy it up, and then we're going to be working with the health and safety associations to get it up on the Health and Safety Ontario website so all organizations can access it free of charge.